Insertion of a peripheral venous catheter. Infection prevention and control, IPC principles and best practices. The working table must be cleaned and disinfected using alcohol or another non-corrosive disinfectant. Make sure to disinfect both the table surface and the table legs. Prepare everything you're going to use for the insertion. Start adding alcohol-based hand rub, non-sterile gloves, sharps container, a waste bag for both infectious and non-infectious waste. Continue adding insertion set containing gauze, forceps and scissors, tape for tube fixation, transparent semi-permeable dressing, a tourniquet that can be disinfected, skin antiseptic. Ideally, use a product containing both alcohol and a long-acting substance such as chlorhexidine. Stopcocks connected to an extension tube if available. Single-use protection cover. A selection of catheters with different sizes. A syringe. A needle. Normal saline. An etiquette to label the syringe. Perform hand hygiene before touching the patient by using the correct World Health Organization technique. Put the patient in a comfortable position and explain the details of the procedure. Check the identity of the patient. Peripheral venous catheters are placed on the forearm or the dorsal side of the hand. Attach the tourniquet. Look for a suitable vein and choose the appropriately sized cannula. Remove the tourniquet. Perform hand hygiene after touching the patient. Unwrap the insertion set using an aseptic technique. The set serves as a sterile surface where all sterile instruments are placed. Pour alcohol-based disinfectant onto the sterile gauze pads. Put syringe, needle and prolongation onto the sterile surface. Prepare the transparent semi-permeable dressing or sterile gauze and adhesive dressing, whichever is available. Perform hand hygiene before an aseptic technique. Prepare the syringe with saline following the principles of aseptic and non-touch technique. Perform manipulations on a gauze pad soaked with alcohol-based chlorhexidine. Disinfect the neck of the saline vial before opening. Fill the syringe with normal saline. Throw the needle immediately to the sharps container. Connect the syringe to the prolongation tube and fill the tube with saline from the syringe. Place the etiquette indicating the content onto the syringe. Perform hand hygiene before touching the patient. Repeat skin antisepsis of the insertion site 3 times, applying spiral motions from the center to the periphery. Let the antiseptic dry after the last application and put on the tourniquet. Perform hand hygiene before an aseptic technique. The healthcare worker puts on a clean, non-sterile pair of gloves to protect against direct contact with blood. Mobilize the needle inside the catheter. Pull the skin with your thumb before puncture. In case of increased skin resistance, wait a second after penetrating the skin before puncturing the vein. Maintain an angle of 20 to 30 degrees. Use a non-touch technique and make sure that the fingers are at distance to the insertion site. Upon blood reflux, slightly pull back the needle and push the catheter completely into the vein. Remove the tourniquet. Put a sterile gauze pad under the catheter. remove the needle completely and connect the catheter to the pre-filled prolongation syringe system. Throw the needle to the sharps container. Test patency and flush the catheter with saline. To cover the insertion site, choose either a gauze dressing or a transparent semi-permeable dressing if available. A transparent semi-permeable dressing is preferred because it allows direct inspection of the insertion site and can be left in place for 7 days. A gauze dressing does not allow direct inspection of the insertion site and must be changed every other day. Connect the infusion to the prolongation tube or directly to the catheter on a gauze pad, impregnated with alcohol-based chlorhexidine. Clean up the working site while still wearing gloves. Remove gloves and perform hand hygiene after all contaminated material has been removed to the waste bag. Document indication, date and time, and insertion site in the patient chart. Ask the patient about discomfort and check the insertion site for signs of extravasation. Perform hand hygiene after touching the patient.